The left foot, the left ankle. This is your, what we call the tibial bone, which is the big leg bone. There's a smaller bone here called the fibula.
Yes.
And then the talus sits right here, which is the ankle bone, like this. Now the ankle itself, the ankle bone itself is attached to all these bones together, so as the ankle bone doesn't just fall around. With you, it's very, very much loose. So what's happening is there is a ligament in the back, okay, and it's attached to the back of this bone, and it's attached to the back of this bone, all right? Then there's another ligament up here that it attaches here all the way down like this.
Okay.
Then there is another ligament that goes down all the way down to the heel bone, okay? Now between the three ligaments, this is very nicely stationed. There's also another ligament that goes here. There's a ligament goes here, and again there's a ligament on the back end of that, okay? And then there's a capsule of the joint. Now there's a whole bunch of ligaments up here too on the inside. We're not going to touch those, all right?
Okay.
We're just interested in this because those are the ones that are having issues, all right? So what we do usually, because that ligament is kind of thin, you know, and it's not that thick usually. It's one of the weakest ligaments between the three of these. So sometimes it's attenuated. Attenuated meaning that instead of having a thick, if I cut through this here, let's say, the thickness of it becomes thinner.
Okay.
You know, so because it becomes thinner and it's not functional, it could be there. I mean, you could see it on MRI that it's there, but then it's not functional. It doesn't mean nothing, you know. It just means that it is there. Sometimes you see that there is fibers that are broken and or separated, whatever. But that's not always the case. So it's not always the case that you get a report that's positive for an actual problem. You know, clinical is very important. So once we get to do this, what we do at that point is we open up an incision right here on top of this. Now we can do this with minimal incision, whereby we put small incision right here, and just do it, you know, via X-ray guidance. But if I feel like, you know, this is not gonna do the job, then I do a cut right here, okay?
Okay.
Once I do a cut right here, I can see the whole ligament. Then we go inside here. We put anchors in the bone right there, okay? Sometimes one, sometimes two, depending on what I need. Those anchors have stitches that come out of them, and then those here are you know, sutures. And then we bring it over here and we anchor it right into this bone.
Okay.
And as we do that, we're trying to get this ligament to heal, give it time to heal, because the onslaught of this moving this way and down, it's causing this ligament to be a problem.
Okay.
So
they generally heal pretty well on their own.
Exactly. Well, once we do this,
yeah,
then it makes it more stronger,
okay,
you know, and it makes it very, very nice for the patient. Now, sometimes also, if I open this up and I'm looking at it and I see that it's very, very thin, we have skin grafts that we get from the skin bank that are like pieces of only the matrix of the skin, nothing else.
Okay.
Okay? And that matrix has no cells, so we call it acellular dermal matrix. And that matrix has like connective tissue inside of it. And once I put it on here, those cells then will migrate into this, making it its own.
Okay.
All right? And as the cells migrate in here, they already have the matrix for them to build a new ligament. Makes sense?
Yes.
And once I do that, then I stitch it right into the actual area where I put it. So this here goes on here.
Okay.
Do you see that?
Yep.
This is called augmenting. So we're augmenting the ligament. Now the old technique used to use a muscle, a tendon right here. You would put a hole, then reattach it to itself and attach it down here. I don't like to do that simply because you're actually using tendons that you need.
Yeah.
So rather than using tendons that you really need and you're supposed to have, I'm just using something that we can do without having this, okay? There's a name for this technique. Everything has a name. Doctors who discovered those techniques have their names on them. But the basic science is what I just explained.
Okay.
Okay? Any questions about this?
No.
All right. So this is called ATFL injury repair.